My name is Monica Bryant. I am a cancer rights attorney and chief operating officer for an organization called Triage Cancer. Triage Cancer is a national nonprofit that provides education on the legal and practical issues that come up after a serious medical diagnosis like cancer. Now, many times when I tell people out in the wild that I'm a cancer rights attorney, the response is, "What's that?" Or, "Well, what's legal about cancer?" And my answer back is actually almost everything. From what drugs somebody has access to what insurance companies are required to pay for, to what employers are or aren't allowed to do, and everything in between. And so we spend a lot of time talking about a number of different legal areas, and we do that in a couple of different ways. So we host free educational events for patients, caregivers, and healthcare professionals. We have a plethora of educational materials available on our website. We have charts of state laws because we can't just talk about the federal law. We also have to talk about what's available in each state as well. And then we do provide one-on-one assistance via our legal and financial navigation program. And while at our core, we are a cancer organization, what we also know to be true is that these issues aren't just about cancer. They don't just come up after a cancer diagnosis. So we've recently launched a program called Triage Health, where we are providing all of the same information without the word cancer in it. And so I say that at the front of this because we only have 45 minutes together, and it may turn out that you have questions or you're helping patients and caregivers with other legal topics, and we want you to know that Triage Cancer can be a resource for you as well as them. Now, in 2013, a term was coined. This is old at this point, right? We're a decade into talking about financial toxicity. And really, financial toxicity was a term coined by researchers out of Duke University. And they compared the financial burden that can occur after a cancer diagnosis to the physical burden or toxicity that many cancer treatments can cause. But what was really interesting about this particular research was they didn't just look at how it was an impact in an acute way during active treatment, but how there was often a long-term impact on their finances. So here we are 10 years later, still talking about financial toxicity at every single conference I speak at. So why are we still doing that? Why are we still talking about financial toxicity 10 years later? We think it's because there are multiple contributing factors. And if we as a healthcare ecosystem aren't addressing all, or at least most of the contributing factors, we're never going to effectively be able to help people avoid financial toxicity. And the number one most significant factor contributing to financial toxicity is health insurance status. And sure, that could mean someone not having health insurance at all. But more often what we see is it's people having inadequate health insurance for their needs or not being able to effectively navigate their health insurance policies. And certainly the appeals process, what we are here to talk about today, is a piece of that navigation puzzle. So I'd like you to meet Carmen. She's 29 years old and has been diagnosed with breast cancer. Her doctor told her that her treatment may impact her fertility and her ability to have biological children in the future. The doctor recommended fertility preservation options. Carmen decided she was interested in those preservation options, but when the healthcare team checked with her employer-sponsored health insurance, insurance said, "Oh, that's not a covered benefit." Carmen can't afford to pay for fertility preservation out of pocket, and she doesn't know what to do. So Carmen really sets up our conversation around accessing care while also maintaining financial health. And one of the challenges that we see people come up against is oftentimes the first response to expressing financial challenges is, "Let's get you financial assistance," or "Let's apply for charity care." Now, financial assistance and charity care are incredibly important programs and benefits for people to know about and be able to access. But oftentimes, they're only going to fix a small part of the problem. What we want to try to do is catch people further upstream in this whole process. So that sure, they may still need that financial assistance to address other issues, but if we can get them adequate health insurance and teach them how to effectively navigate their policies, we can solve more of the problems and get them access to more of the care that they need. And so really, that's what brings us to the discussion around appeals. This probably won't come as a surprise to many of you that denials in healthcare are a very common occurrence. In fact, every time I say to people, 14% of all claims are denied, people kind of go, well, 14%, that's not that much. Until you look at the actual number of claims. We're talking about more than 200 million claims per day are denied in this country. That's astonishing when you actually stop and think about it, right? What we also know is that people don't know what to do when they get that denied claim. And even when we are training healthcare providers, and I should have said this earlier, when we talk about healthcare providers, we use the biggest umbrella possible. So we are talking about patient advocates and community health workers. We are talking about clinical health workers. I mean, it is everybody who is touching someone who identifies as a patient or a caregiver, we encompass as healthcare providers. And many times people will come to us and say, I'm working with this patient, they got a denial, so, I have to appeal, right? And we say yes, but then there's a whole bunch of other questions that come after that. So I have a question for you all, and I know we have a mixed audience today, but how many of you have actually submitted an appeal for a denial? So a good number of you. How many of you feel like you have an absolute stellar handle on how to appeal in every type of health insurance? Oh, some brave folks in the room. I love it. I love it. One of the challenges is that we get healthcare from a variety of sources, or health insurance, I should say. But they can really be put into three categories. So about 50% of Americans get their health insurance through an employer. The next largest group gets their insurance through the government, primarily through Medicare and Medicaid, but certainly also through military benefits as well. And then there's the people that go directly to a health insurance company to buy health insurance. And in every level of our triangle of coverage, people are facing denials. Sometimes it's denials of services, sometimes it's denials of eligibility. And certainly when we talk about government benefits, I think that is a bigger issue. One of the major challenges is even within these different groups, there are pieces of information that we as consumers of healthcare have to understand. Given that half of Americans get their insurance through an employer, how many of you in the room can identify the difference between a funded and a self-funded plan? Like 5 people in the room. But half of Americans get their insurance through an employer, and knowing the difference between a self-funded and funded plan is critical. So when we talk about employer-sponsored coverage, we have to know if someone has a funded or self-funded plan. So let's make sure we level set here. When an employer collects premiums and contributes to the premiums and then sends that money to an insurance company, and then the insurance company provides insurance to the employee, that's called a funded plan. Also known as an insured plan because we like to make things as complicated as possible. The other type of employer-sponsored healthcare is actually where the employer is paying directly for the employee's healthcare costs. And that's what's called a self-funded plan or self-insured plan. The employer is self-funding the medical costs for the employees. Sounds simple, right? Here's where it gets tricky. Most employers that run self-funded plans contract with a third party to administer those plans. And guess who that third party is? Health insurance companies. So as a consumer, it is really hard to figure out if you have a funded or self-funded plan. But knowing that piece of information is going to be critical for the very first step of the appeals process when you get that no. Because the very first step is, what type of plan do you have? Because that's going to give you information about what next steps you actually have to go and take. And there's big differences between an individual or a funded group plan where an insurance company is providing insurance, and a self-funded plan where an employer is paying for the healthcare costs. So already, step one, we're putting barriers in front of patients and caregivers. We're making this hard for people. Once we've figured out what type of plan somebody has, then we have to figure out, okay, well, what are the rules for that type of plan? When we are talking about individual or funded group plans, there are generally going to be two levels of appeal. The first level is what's called an internal appeal, where you're going back to the insurance company and saying, please reconsider. Now, when we are talking about internal appeals, these appeals can occur before services have ever been received. So someone's gone in and asked for prior authorization for services, insurance come back and says, no, you can appeal internally at that point. You can also appeal internally after services have been received, right? So I've already gone in and gotten my treatment. I now get the bill. Insurance says, no, we're not covering it. Step one is going back to the insurance company. Now, one of the challenges with this is that every insurance company has different rules about the internal appeals process. And some of them are ridiculous, if you ask me. Like, it has to be in 12-point font, signed with a blue pen and faxed. Who has a fax machine anymore? Yet that's the requirement. So it's really important for people to be following those specific rules. So if you're helping a patient with, and I'm just making this up, Aetna, and you're helping a patient with Blue Cross Blue Shield, they may have different requirements at this internal appeals. Another barrier. Now, there's some timing requirements here too. So someone has to file an appeal within 180 days of receiving the denial. On first look, that seems like a lot of time. But if we're thinking about people who are dealing with serious medical illnesses, right, 180 days can come and go before the mail's even opened to figure out that there's been a denial. So this timing piece can be a barrier. And then depending on where somebody is in receiving care, the timing requirement for the insurance company to respond is different. So if you're at a prior authorization denial, then the insurance company has 30 days to respond. If someone's already received treatment, then the insurance company has 60 days to respond. But here's the thing. When we're talking about a serious medical diagnosis like cancer, before services have been received, sometimes people can't wait 30 days to get a response. In fact, most of the time, you can't wait 30 days for a response. So in situations where the need for care is urgent, and there's a definition here, then someone can ask for what's called an expedited appeal or an urgent appeal. And then the insurance company has to give an answer within 72 hours. Timing requirements, barrier. So what happens if someone goes through the internal appeals process and the insurance company is still like, no, we're not covering that? Thanks to a number of different laws, we also have an opportunity for another level of appeal called an external appeal. And this is an opportunity for an individual to go to an independent entity and have the independent entity make a decision as to whether or not the insurance company should have covered it. This is available in every single state now, thanks to the Affordable Care Act. The specific details do vary state by state, but on triagecancer.org, under our state resources, we've identified the entity you go to file the external appeal in each state. Now, the good news is that the decision of this external appeal is binding. So if it's decided in favor of the patient, great news. Bad news is it's binding. So if it's decided in favor of the insurance company, not so great news. Now, one of the things about this appeals process is it is an additional burden. It's an additional burden on the patient and their family. It's an additional burden on the healthcare team. It's an additional burden. However, we know that somewhere between 40 and 60% of all appeals are decided in favor of the patient. So conservatively, to make the numbers easy, half the time when the insurance company is saying no, they're getting it wrong. This is an incredibly important thing for patients and families to understand. And I will tell you, although I know many of you have filed appeals, there are many rooms of healthcare providers that we train who don't know about the appeals process. Or they know about the internal appeals process, but they don't know about the external appeals process. And so there is absolutely an opportunity here for us, again, as an ecosystem, to be spreading the word about these programs. Now, with external appeals, there's also a timing requirement. So you have to file your external appeal within 4 months of getting your final denial from the internal appeal. And usually you have to exhaust your internal appeals before you get to go to an external appeal. But remember those situations when the need for care is urgent? Same thing with the external appeal, where you get an answer within 72 hours. And the law recognized that, hey, if we make someone go 72 hours for the internal and then 72 hours for the external, we're now talking about, almost a week. That could even be too long to get an answer in some circumstances. And so the rules are that if it is urgent, you can file the internal appeal at the same time as the external appeal and get an answer from both within 72 hours. So this is sort of the life cycle of an appeals process. And, left-hand side is best case scenario, where someone receives treatment, a claim gets filed, typically by the provider, the insurance company approves it, they pay their portion based on where the person is in the year, and then the provider sends the patient their remaining bill. But of course, we're here to talk about when an insurance company says no, so we're on the right side. Generally speaking, someone has to then file the internal appeal. If they lose the internal appeal, they can file the external appeal. But as a reminder, we can do all of this before care is ever received. And this, I think, is one of the major barriers for people to access care. And oftentimes, when they are in places that don't have well-educated healthcare teams, the answer is your insurance isn't going to cover it, so either you don't get the care, or we're going to try to find you financial assistance and charity care. This should be step one before we get to the financial assistance and charity care. Now, I mentioned that things look different if someone has a self-funded plan, because in that situation, you still have the opportunity to file the internal appeal. But remember, in self-funded plans, your employer is paying directly for your healthcare costs. So you are actually going back to your employer and saying, reconsider, will you cover this service? But again, can be really confusing for people because they might be dealing with that third-party administrator who may be an insurance company. And believe it or not, those third-party administrators can have different internal appeals rules for their self-funded plans and their funded plans. So you also can't just assume, oh, I filed a ton of Blue Cross Blue Shield's appeals, I know what to do, because that might be for the funded plans and it could be different for the self-funded plans. Another barrier. Do you see a theme? So when we're talking about, we should also say this, when we're talking about self-funded plans, there is an opportunity to appeal externally. There's also, which is different from funded plans, an opportunity to sue in court, but the recovery, like what someone actually gets if they win in court, is very limited. It's only going to be the cost of the actual service, and it can be very time-consuming. Also, remember, you're now suing your employer. Challenges. Okay, so once we figured out what the plan type is, what the rules are, step 2 is why? Why did the insurance company deny the claim? And there are a whole bunch of reasons that an insurance company might deny the claim. And the why is going to help us figure out what the next steps are. Now, I will also say, once we figure out the why, which may be in the original denial, sometimes it is well explained, sometimes it is not, it is also helpful to get the full plan benefits language, also sometimes called the evidence of coverage. Now, I will tell you, I think it has gotten increasingly more difficult to get the full plan benefits language. I personally experienced a situation where when I called, I was told, oh, that doesn't exist somewhere in a way that I can send it to you. And I said, the law requires that it does. Imagine what arrived in my email. So, knowledge is power though, right? If someone doesn't know what the law is and someone is told by the insurance company, oh, we don't have a way to give that to you, we can't send that to you, most people are gonna go, okay, well, what do I do next? So understanding where the rights are is helpful in this process because it's also gonna help us understand, when we understand the why and we look at the full plan benefits language, then we're gonna know what our next steps are. So one of the very common reasons in serious medical conditions like cancer that someone gets a denial is that the service was experimental or investigational. Now, sometimes that's because something's being prescribed off-label, but sometimes that's because somebody is in a clinical trial. Understanding the why it's considered experimental or investigational is going to help us figure out what evidence that we need. Because if it's that they're in a clinical trial, well, then I have state and federal laws that I'm going to share with you about what you do or don't have to cover. If it's that it's off-label, then I'm going to want to gather different evidence, which we'll get to in just a minute. But certainly that would be your opportunity to submit your appeal. Now, if you haven't started treatment yet and it's urgent, what are you going to do? Right. Internal and external at the same time. Let's say that the reason it's considered experimental is because it's off-label. It hasn't been FDA approved yet for that specific condition that that patient has. Well, then I'm going to gather some evidence of medical necessity. And medical necessity is the legal standard on which the appeals are going to be decided. So what kinds of things can speak to medical necessity? All sorts of things. So I think starting with a letter from the doctor is helpful, right? The doctor that prescribed it had a reason for prescribing it. Certainly any sort of notes in your medical records or tests, test results, or a personal narrative as to why the particular service might be needed. So maybe someone is taking a different drug because they're allergic to the standard of care. And so being able to talk about that in a personal narrative supported by the medical evidence could be helpful. If there's any sort of current literature, I mean, typically when someone's prescribing something off-label, there's something that supports that. And so that could come from medical journals. A lot of people don't realize, because when you just start Googling, the first things that come up are like they're behind paywalls. Most patients can't can't pay for that, can't access that. But PubMed is a government-run database that is completely free to access. So even if a patient has a healthcare team that maybe doesn't have the capacity to help with appeals, because that's a reality in this country, right? Not all patients have access to robust healthcare teams with social workers and financial navigators and patient advocates. Even those individuals that aren't supported can still access the same medical literature. But again, knowledge can be a barrier. So all of these things can speak to medical necessity, and really that's why it's so important to understand the why, because the evidence you're going to gather is going to be different based on the why. Now, another really common reason for denial is that that service required pre-authorization, and you didn't get pre-authorization, so we're denying it. Even if they would have granted the pre-authorization, they can still deny it based on the person not getting the prior authorization. And a real practical challenge for patients is sometimes healthcare teams will submit the prior authorization on their behalf, which is a wonderful service to do for patients, but it doesn't always happen. And guess who is ultimately responsible for making sure that prior authorization is submitted? The patients. So here we have a real practical challenge, but then we also have an appeals challenge. So if the reason for the denial is, well, you failed to get a prior authorization, the ask in the appeal is, can I have a retroactive prior authorization? And I see nodding heads. Again, like this is old hat. This is stuff you guys have done before. But think about average Joe or Jane on the street. Most people don't realize that there's even the ability to ask for a retroactive prior authorization. And then if that isn't granted, there is potentially an opportunity for an appeal. I say potentially because that is how these contracts work. If you're required to get a prior authorization and you don't, the insurance company can in fact say no. Another common challenge for people is that something is denied because it's coded as diagnostic versus preventative. It could also be maybe it's not denied, but maybe someone is charged more because it's coded as diagnostic instead of preventative. If it is supposed to have been preventative, what are the opportunities or what's the action that somebody can take? Well, certainly going back and having a conversation with the provider. Like, let's talk about these CPT codes and why did you use this versus this? But the second thing is submitting an appeal, making sure that the insurance company understands that it was miscoded. I think the easier course of action, if the healthcare team is on board, is to just resubmit the claim with the proper CPT code. And sadly, many of those 14% of claims are denied because of mistakes, right? Like medical billing is a human process. And what do humans do? Make mistakes. But the number of people that call us panicked over the bill that they have received, not even realizing that it is potentially because of a mistake. So incorrect patient information, misspellings, wrong, phone numbers and zip codes, certainly missing or invalid codes. I mean, we've seen all sorts of strange things, like things being, switched around on things. So our message to patients constantly is you have to review your bills for accuracy. Again, seems old hat to all of us sitting in this room, but to the average person, they just don't realize that they should be doing that. Another common one is coordination of benefits. If somebody has more than one type of insurance coverage, it can be incredibly helpful for them. It can also be a logistical nightmare. Typically, when someone has access to more than one type of coverage, those insurance sources will send a letter yearly called the Coordination of Benefits letter. And then the person fills it out and basically says, like, yes, I have other coverage and here's what it is, or no, I don't have other coverage. The number of people that run into challenges because they just don't fill out this form is astronomical. And it causes, again, a nightmare for patients and families because they have to call both companies. Usually the companies are like, that guy's the primary payer. And so by filling out these forms yearly and making sure your patients know that they have to fill out these forms yearly, we can help eliminate some challenges. Now, there are a whole bunch of hurdles when it comes to the appeals process. I've talked about some already, but even things as simple as getting your medical records can be really challenging. So for someone who's received care maybe across different hospital systems that don't have EMRs that talk to each other or in different states, that can be incredibly challenging. It can also be a challenge for people because sometimes medical providers put additional hurdles in front of them, like charging. And there are rules on what insurance companies can and can't charge. Other hurdles are staying organized. The number of people who say to me, like, yeah, I talked to so-and-so, hold on, it's on a Post-it note somewhere, right? And they've lost the Post-it note. So we have tools at Triage Cancer, like our tracking form, that try to help people stay organized in the appeals process. This can just be downloaded for free. Another challenge that we see people come up against is the concept of peer review. So on its face, peer review makes a lot of sense. It's one healthcare provider talking to another healthcare provider and having a conversation, right? That sounds great. So many challenges. One challenge is that the healthcare provider that the insurance company hires is often not of the same practice type or specialization as the prescribing physician, right? So you have a retired OBGYN talking with a doctor who's up on the latest precision medicine. There's just a knowledge disconnect there. The other challenge is that many times the insurance companies are holding up the peer review as if it is the same thing as an external review. And it is absolutely not. It is just another level of internal. So even if someone loses at the peer review stage, they have the opportunity to have that external appeal with the independent entity. And finally, the largest and probably most significant hurdle is knowledge. We don't have data from every health insurance source because the law doesn't require them to provide this. But from the marketplaces, we know that in 2021, there were close to 49 million denied claims. 99.9% of them were never appealed. But remember, I said about half the time, when the insurance company says no, they're getting it wrong. But 99.9% of them are never getting appealed. And so when we talk about combating financial toxicity and helping people afford their care and accessing care, this appeals process should be step one. Before we're talking about applying to charity care or financial assistance. Because if they have insurance and insurance should be covering those costs, great, make them do that. And then let's save the financial assistance or the charity care for the other out-of-pocket expenses they might have. So again, there's a real opportunity, not just for you all sitting in the room and those of you joining us virtually, but to educate your friends and your communities and other providers you're in contact with about the appeals process, because it is so incredibly impactful. So remember Carmen? Carmen needed fertility preservation. Simple. If the doctors, as soon as the healthcare team got the no, we don't cover that, file the internal appeal and the external appeal as an urgent appeal, she gets an answer within 72 hours. And let me tell you specifically, with oncofertility and fertility preservation, there is tons of evidence around medical necessity. Most of the time, when people do appeal this, they win. Yet, the number of people we talk to who say, I didn't have time to wait and I couldn't afford to pay for it out of pocket, so now I've lost my chance at having biological children. I mean, I would say it is I won't put a number on it, but it's a lot of people we talk to. And so sometimes these issues, and this is just one example of them, we try to solve these problems or these coverage gaps legislatively or through policy, which is super important. It's also really slow. So if we can start addressing these access to care issues by using the appeals process as a vehicle to do that, not only are we getting patients the care that they actually need, but we're also actually showing the regulatory bodies in these states, when they see lots of appeals on a particular topic, they can actually issue what are called all plan letters, where they basically tell the plans in their states, hey, we think this is medically necessary and you should be covering it. It is an important vehicle, not just for the person who's getting care by virtue of their appeal, but it is also a way to more quickly, systemically address some of these challenges. So I will just say that, of course, I've focused on individual and employer-sponsored insurance, but there is absolutely the appeals process through the Medicaid program. It is not as consumer-friendly because you have to actually file a notice for fair hearing. But if you come across someone with Medicaid who is either being denied access to a service or being denied eligibility access, they have the right to appeal. And if they appeal within 10 days of getting that notice, they can maintain their Medicaid coverage until the final appeal decision comes through. Lots of people miss that 10-day notice because they don't know about it. Similarly, I will just say that within Medicare, there is a robust appeals process, both a standard and an expedited. But where it gets super tricky in Medicare, is that the details depend on which part we're talking about. So I won't go into them in detail today, but just know that if someone has original Medicare, they have 5 levels of appeal. We have detailed information on our tool called Cancer Finances on our website. If someone is appealing Part D coverage, they also have 5 levels of appeal, and an expedited appeal for Part D, 24 hours. So if someone is being denied access to a prescription drug through Medicare, they can get an answer within 24 hours if they know they have the right to file the expedited appeal. So what about all the other types of plans? Well, less good news. So for these types of plans that frankly most of the time really aren't insurance, the options are severely limited. And it's why, as a healthcare advocate myself, I generally do not suggest these types of plans to people because they aren't comprehensive healthcare. And now we have more options for coverage in our country for most people. So if someone gets a denial in these types of plans, potentially they could contact their state department of insurance, but most of the time they're going to say it's not insurance, so we don't deal with that. They could attempt legal action like filing suit for a breach of contract, but most importantly, they can make a new choice for next year. And that's really the message that we want for people who have these types of plans, who don't have comprehensive coverage and likely have a serious medical diagnosis, if you're talking to them. Get better coverage next year. And there are all sorts of options to do so, many of which are more affordable than they have been in the past, thanks to legislation that's been passed in the last couple of years. So I just want to, cool little tool we have. We have tons of resources on our website that are all for free. We have them under both the Triage Cancer and the Triage Health banners. You can order bulk hard copies if you would like them. But if you have questions about appeals or other cancer-related legal issues or healthcare-related legal issues, I just want to mention a couple of opportunities where you can get more information, including our upcoming Triage Cancer Conference. This is open to patients, caregivers, healthcare professionals, really anyone who wants to learn. We do provide free CEs and contact hours for a number of different professionals, including patient advocates, and we will provide certificates to community health workers. We have a monthly webinar series where we present these live and provide CEs. We also record them all. So if you're working with a patient and they want to understand their Medicare options and you're like, I don't have an hour to explain all the different parts of Medicare, you can send them to go watch this webinar first and then have them come back to you with questions. We also have a healthcare professional training called the Insurance and Finance Intensive. This is a day-long program where we do a deep dive. And we really try to break down the relevant laws that can help people access care and avoid financial toxicity. But even with all the resources and materials and events that we host and we have, oftentimes people need to just have their question answered. And that could be the patients or caregivers themselves. It could be you all if you come across a particularly sticky situation and you just don't have the answer. So we have a legal and financial navigation program where someone can fill out a form on our website. They get an email with the link to schedule a call with us. We get on the phone and we explain the options. Sometimes it requires a second phone call, but you can refer your patients and their caregivers to fill out this form, or you can fill it out and we'll talk to you all and then you can relay the information back. Nope. Listen. If someone calls us with a question, we're going to answer their question. Yeah. We are not in the business of hiding the ball.